And we are back this morning. We are joined now by Gary Harkins. Gary, a small business owner, thank you for joining me this morning.
Thank you for having me.
Small business owner, how many employees do you have?
We have 15.
15 employees on your payroll. Do you have health insurance for your employees?
We do provide health insurance, but the employee has to pay for it.
And how much, on average, does that employee pay for the health care coverage? Is it like a COBRA type plan?
The average annual, well, you have to go back to single versus family, but a single person would pay about $500 a month for single coverage. A married family would pay at a little more than, about twice that much.
All right. Your big concern with what has passed, that the president has pushed through, what is your big concern about it, providing for small businesses having to provide health care to its employees?
I think the biggest problem is the mandate. In 1993, Hillary Clinton and Bill Clinton, President Clinton, proposed a mandate for health care. It was defeated, never passed through Congress. This one has passed. So we feel that it takes away the options of small businesses. If I have to spend money for my employees' health care, I'm going to have a harder time making a profit. I'm going to have a harder time in generating working capital to run my business.
And understandably so. But in this new proposal, right, if you have fewer than 25 employees, you're going to get a tax credit of up to 35% to offset that insurance. And in the year 2014, that credit will increase to 50%.
I don't disagree that there is a credit available, but it has a lot of parts. There are some things, if you don't provide at least 50% of the cost of the insurance to your employees, you don't get the credit. As you add employees, you don't get the credit. If your employees make above a certain salary range, $25,000, you don't get the credit. So it sounds good, there's a credit there, but it's tailored so that it's a very narrow focus. And many businesses will not be eligible for it. It will actually be phased out over time. So it may give some small businesses temporary credit. In my business, I'm paying my people a little bit more, so I most likely would only be a small amount of that would be available to me. But the cost would be, if I chose not to give my employees insurance, I would pay a penalty.
Well, then as a small business owner, wouldn't then be a good argument to say that the government should have a health care system and provide health care for everyone?
Well, no, I don't.
Then the burden wouldn't be on you.
I don't trust the government to provide that. They've done a lousy job with Medicare.
But then employees could say, well, we don't trust our management, our business owners, to take care of its employees.
Well, I think that's a fallacy, because when you hire an employee, you make a contract with that employee. They do certain things, you do certain things.
My employer takes care of my health benefits. I pay in part to a system, right, but I am provided health care. I don't have to pay the full amount, but I am provided some.
But that's part of your compensation. It's part of your compensation. The cost of an employee is their salary plus their benefits, plus the government taxes that you have to pay. So that compensation can be in many forms. It could be in benefits. If I reduce a benefit to an employee, I'm probably going to have to increase their compensation as a result. So I'm not talking about displeasing the employee, because I need the employee. I'm going to pay the employee what the market will bear in order to have that employee and make them productive. So it's just how much of that compensation am I going to spend on the benefit versus just giving it to the employee and allowing them to make their own choices.
All right, and we'll see what happens as this all continues to unfold.
It's going to be
more repeals out there, and more people wanting to take it to the courts, and who knows what.
But we're trying to plan for the future, and the problem is it's just unsettling. You can't plan for the future. You don't want to hire employees if you don't think your business is going to be in business a year from now. So what's happening is there's a chilling effect on employers as a result of the uncertainty of the bill. We need clarification.
All right, Mr. Harkins, thank you for joining us this morning, and thank you for your time. We appreciate
Brandon.
it.
Thank you very much.
All right. As for the lawsuits challenging the constitutionality of the health care law, only time will tell if it'll make it through. Thanks so much for joining us this edition of Public Affairs on Peach. We'd love for you to join us on the conversation. If you have a topic you'd like to see us cover, let us know. Send us an email to publicaffairs@cbsatlanta.com. That'll do it for this week's edition of Public Affairs on Peach. We'll see you back here next Sunday morning. Have a great weekend.